guys, welcome back to my YouTube channel. So we are going to continue from where we stopped the last time. So we are going to look at the osteology of the scapula. Okay, so this bone here is called the scapula, and it's a kind of flat bone. Can you see it is kind of flat? And when you look at the shape looks triangular. Okay, so it's a triangular shaped structure. Okay, and it's also called the shoulder blade. And this bone as well, you can see it is located on the upper thoracic region, dorsal to the rib cage. So it is located dorsal to the rib cage on the upper thoracic region. Okay, so this scapula as well, it extends from the second ribs to the seventh ribs. So let's count. So this is the first rib, second rib, third, fourth, fifth, sixth, and seventh. So it extends from the second ribs to the seventh ribs. Okay, so let's look at the surfaces, borders, and angles of this scapula. So this region here is called the medial border of the scapula. So this region here is called the lateral border of the scapula. This area here, it is called the angle, inferior angle of the scapula. This area too here up is called the superior angle of the scapula. Why this upper region here is called the superior border of the scapula. So how many borders? We have the lateral border, the medial border, and the superior border. Angles, we have the inferior angle and we have the superior angle. So let's look at the surfaces of the scapula using this model. So when you look at the surfaces of the scapula, so this area here is called the costal surface of the scapula. The costal surface, meaning it is closer to the rib cage. Okay, so when looking at this costal surface, we see this surface here is kind of concave and it has hollow parts. Okay, so this hollow part here is called the subscapular fossa. This area here is called the subscapular fossa, and the main dominant muscle within this subscapular fossa here is called the subscapularis muscle. Okay, so another feature that we are going to see here is this hook-like structure, hook-like projection here. So this hook-like projection here that is located superior-lateral surface of the costal surface is called the coracoid process of the scapula. So this is called the coracoid process of the scapula. And take note, there are three important muscles that originate from this coracoid process. One is the pectoralis minor. Two is the coracobrachialis muscle. And the last one is the short head of the biceps brachii. Okay, so let's come back again. The muscle that originates from the coracoid process here, one is the pectoralis minor, two is the coracobrachialis muscle, and the last one is the short head of the biceps brachii. Now, let's look at this area here, located at the superior border of the scapula. So this area here is called the suprascapular notch or the scapular notch. Okay, so this scapular notch here is being transverse. It is being entirely transversed or formed into foramen by a ligament called the transverse scapular ligament. So this transverse scapular ligament turns this notch here into foramen. And this foramen allows the passage of suprascapular nerves that will innervate this muscle called suprascapularis muscle. Okay. Then this area here plays important role in anatomical variations in different people. So some people will not have this suprascapular notch, while some will have what we call suprascapular stenosis. This always results in what we call the suprascapular nerve impingement or suprascapular nerve entrapment, resulting in pains. Okay, so the knowledge of anatomy will make us to understand the variation among peoples with suprascapular notch or not. Okay, so when we let's look at the posterior surface of the scapula. So this is the posterior surface of the scapula. So let's look at the features we can see on this posterior surface. Firstly, we are going to see this thing here. So this is called the spine of the scapula. So this spine of the scapula is going to demarcate this area and this area. So this area here is called the supraspinous fossa. supraspinous fossa. So the dominant muscle here is called the supraspinatus muscle. Supraspinous muscle as well. So inferior to that, we have this one here. This is called the infraspinatus muscle. Okay, infraspinatus muscle. So we have infraspinatus fossa, supraspinatus fossa, demarcated by the spine of the scapula. So this spine of the scapula will now continues to become what we call the acromion of the scapula. So this area here is called the acromion of the scapula. So this acromion of the scapula is going to articulate with the acromial end of the clavicle here to form a joint here called the acromioclavicular joint. The acromioclavicular joint. Okay, so let's look at the lateral surface of the scapula. So this is the lateral surface of the scapula. And let's look at the features we're going to see there. So the most important features that we're going to see here is this cup-like structure here called the glenoid cavity. So this is the glenoid cavity here that articulates the head of the humerus to form what we call the glenohumeral joint. Okay, so then there is a notch here that allows the communication between the infraspinatus fossa and the supraspinous fossa. So this notch here is called the spinoglenoid notch that allows communication between the supraspinous fossa and infraspinous fossa. So they also allow the passage of suprascapular nerve and arteries. They also bound by a inferior ligament, one transverse ligament in this area too. So this area here is called the supraglenoid tubercle here. So this serves as attachment of long head of the biceps brachii. And then this area as well here is called the infraglenoid tubercle that serves as attachment for the long head of the triceps brachii. Okay, so this area here is called the neck of the scapula. The neck of the scapula. Okay, so let's look at this clinical correlation of this scapula. And one thing is important about this scapula is that there are about 17 different muscles that attach on the scapula. So these 17 muscles make it difficult for the scapula to fracture. Okay, though sometimes you can see fracture, which is relatively uncommon. And this fracture can indicate maybe severe chest trauma. Okay, so there's another abnormality again. We call it the wing scapula. So this is a condition where the scapula is protruding out from the back and appearing like a bird wing. So you see the scapula protruding out, forming like a bird wing. So this happened because the muscle that stabilize the scapula, this muscle is the serratus anterior muscle. So when this muscle is kind of that's supposed to stabilize the scapula against the back of this rib cage is kind of paralyzed, maybe as a result of injury to the nerve called the long thoracic nerve, or the dorsal scapular nerve is being injured. So it can paralyze this muscle, causing this scapula to wing out. Okay, this is one of the abnormalities we have. Thank you, and let's continue with the next video.